Hello again. This is Dr. Al-Madi Al-Kammas. I'm Professor Emeritus in the Division of Transplantation at Ohio State. We are going to continue our discussion of the World Medical Association Manual for Medical Ethics. Today will be the first chapter, which is the introduction chapter. And the book starts with the presentation of 5 cases. I'm not expecting you really to read the text, but just to show you that the book starts on page 7 with the introduction and the question, what is medical ethics? And following that, the book presents 4 cases. They are regular cases that deal with regular medical issues. We will go over the cases later on, one by one, as we advance into the book. But in general, the cases, they don't discuss the medical issues. They discuss values, they discuss rights, they discuss patient-doctor relations, they discuss responsibility, and so on. So they will show you what kind of ethical issues in each case. And as we know, the book or the authors of the book recognize that in medical practice there are easy cases and there are difficult cases. The same thing in medical ethics. There are straightforward ethical issues that sometimes you behave ethically or unethically without even you knowing, and there are times when it is a very difficult ethical problem and require major discussion and knowledge with the theory and practice of ethics, as well as usually the laws too. So we go back to the book question, what is medical ethics? The book on page 9 try to answer that question, and we'll focus on the area where the book gives the definition. So in the book it says, what exactly is ethics and how does it help physicians deal with such questions? It's really very appropriate. I mean, if we are interested in doing medicine as science and art, we have to ask this question. So the book says, put simply, ethics is the study of morality, القيم, careful and systematic reflection on and analysis of moral decision and behavior. So what does that mean? It means ethics is a branch where you can study it, and it's really will be reflected in a behavior of the physician toward many issues, but in simple definition, that it is systematic reflection on what? On the moral decisions and behavior. And what else? It's also analysis of moral decisions and behavior. So this reflection or analysis or both, you may be looking at a problem that happened in the past, or currently you are dealing with it, or you were asked to help, or a future. So in the practice of medicine, really, morality is the value dimension in our decision making and behavior. So that is المسطرة اللي بنقيس بيها. ولهذا that's why the language of morality includes rights, responsibilities, virtue, and as well as adjectives such as good and bad, right and wrong, and so on. I will not go down with the book because I have a little bit differences. The book says, according to these definitions, ethics is primarily a matter of knowing whereas morality is a matter of doing, and they have a close relationship. Simply, the way I defined it for myself, morality is what I believe, it's what I collected with my life experience in medical school, as a student, residency, my family, what I read, what I learned from TV, among my friends, and so on. So it's basically that constitute my morality. On the other hand, and that of course is constitute my practice and my behavior, whether it's ethical or unethical. However, medical ethics, there are rules that most of the physicians have agreed on following from many, many, many centuries back. So somebody put those rules clearly to you in articles. So it could be your medical association, could be your hospital, could be your college of medicine, could be where you work, and so on. So it's not really a matter of knowing and doing, it's really each one of them is a matter of both. However, sometimes you may get into situations where your own morals, some of your morals, cannot enforce them on certain patients who have differences in culture or religion. So medical ethics will guide you how to deal with these patients, and maybe this guidance is slightly different from your morals. That's how I put it simply to myself. And this is what I meant. So ethics-specific rules are written for you. It could be by the General Medical Council, by medical association, and so on. And the morals is your own guiding principles based on your life and what have you learned. Also, some differences a little bit between medical ethics and bioethics. So medical ethics is really part of bioethics, but bioethics is more in general that deals with the advances in technology and new things that bring with them technology, medical practice or surgical practice, as well as new ethical issues that we haven't dealt with. For example, bioethics will deal with the COVID-19 or with the medical resources and so on, or with medicine in rural areas, deals with disasters and calamities and so on. Okay, so do we really need to teach medical ethics? In the book, it does say there are some excuses, and actually I heard them myself too. Oh yeah, we have busy curriculum, we really don't have room for medical ethics. The smart doctors don't need medical ethics. I heard that. Ethics are taught at home. Sure, I mean we do. We should teach values and ethics at home, but that's not enough. You may learn it by observation. That's also not enough. So why we teach medical ethics? It has to be a reason. From the definition, really, when we said, reflection as well as analysis of moral behavior. If that's the case, then really you need to have a systematic knowledge about the topic. So it's part of our medical practice. It may affect doctor-patient relationship. It may even affect the outcome. And there have been some studies into that. It goes beyond the respect, informed consent, and basic known principles. So it's really need to be studied. I'm not going to really say things on my own, so we will just stick to the book. And on page 11, What I mentioned in the slides, the book mentioned it on page 11, and also there is a very interesting sentence it's in blue and white writing. It says, the study of ethics prepares medical students to recognize difficult situations and to deal with them in a relational and principled manner. That is really the ethics. So it's not just haphazard. You should have some background in addition to your own values and those background and rules. Then you apply them into your behavior, and you know how to use those principles the same way as you study physiology or anatomy or surgery or gynecology, and you apply what you studied to the care of your patient. So we would not really go over professionalism, but it is part of the ethics, of course. So it is very close to professionalism. It may deal with human rights, so how you deal with this resources and with immigration and treating the immigrants and what are the laws and so on, and the culture. So in general, we really need to teach medical ethics in a systematic manner. And they always say, as well as in this book, that the ethics should give you a higher standard of behavior than even the law itself. And if you look in page 13, the conclusion of this chapter, it says medicine is both science and art, which is true. So science, we deal with clinical trials and new discoveries, with treatments, antibiotics, vaccines, and so on. But the science has its limits when it comes to the practice. So there is religion, there is culture, there is freedom, there are rights, there are responsibilities, there is poor, rich, and so on. So these issues where the art of medicine comes in. So medical ethics complete the other half, or maybe the other third, because medicine is really clinical, research, that deals with the science part, and then the ethics deal with both. Deals with the clinical practice, it deals with the research and so on. Down on page 13, the book says this manual can provide only a basic introduction to medical ethics and some of its central issues. So it's really intended to introduce ethics to you, the whole book. It's not intended to give you a master's degree or PhD or make you or me ethicist. This is basically repeating the same thing as I read to you, so that the book will help us understand further reading if we want to read articles and so on. I think we get to the last slide. I want to thank you so much for listening and watching. Our next short talk will be related to chapter 1 of the book. Till then, I wish you the best, and we'll see you. Thank you so much.